Welcome, Dr. Noha Polack, who is here to speak with us about COVID-19, specifically about vaccinations and mask wearing, but to take questions in general. We have a number of questions that she has already reviewed that we published that she'll go over with us. And then we're going to take some questions from the chat and some that were sent to me via social media from the community so that we can answer all of your questions and concerns. Just so everyone knows, Dr. Noha has her practice here in Union City. She's a local pediatrician. She already works with our community. Thank you so much, Doctor, for being here with us today. We are really grateful for you taking the time from your schedule to address these issues and help our parents feel a little safer and more comfortable sending their kids back to school, because schools are opening on Tuesday, September 7th. And we are looking forward to a very successful year, and we want to do it as safely and in as healthy a manner as possible. Thank you so much for joining us.
Well, thank you for asking me to speak to everyone. Hello, everyone. My name is Noha Polack. I'm a pediatrician. I started practicing pediatrics in 1996 right here in Union City. I also grew up in Jersey City. I went to public school number 28 in Jersey City, and I went to high school in Union City, so I'm definitely a local girl. The subject of vaccines is pretty close to my heart because I have children. So I have 2 children, so I'm a mom. When I had to make my decision about whether I'm going to get the vaccine, it was a really easy decision for me. I'm a doctor. I was exposed every day. I wanted my COVID vaccine. So I got it in December and in January, my first and second dose. When it came to making the decision for my children, it was a little bit harder, to be honest with you. I read the studies even deeper than I did for myself. And I understand that our worst fear as parents is for something to happen to our children, including myself. And that's my viewpoint today. Is my job is to help protect not only my own children, but hopefully the ones in the community. So I'm ready for your questions, Ralph. Go for it.
Great. So how exactly, can you explain to us how exactly vaccines work in the body to protect us from COVID-19, and are they safe?
So the mRNA vaccines, which are the vaccines by Pfizer and by Moderna, they're called mRNA because mRNA is a messenger. So the vaccine is a small piece of this messenger mRNA. It's packaged in a big fat globule so that it makes it into the body safely. And then once it goes into the arm, that little messenger is used as a recipe. And the body's cells use that recipe to make a protein. The mRNA itself is very transient, so it doesn't last for more than a couple of days, and then it gets destroyed by the body and it goes away. But that recipe has already been copied, and that protein is made in the body so that when our body is exposed to the virus, it's ready with the antibodies to protect us. So it's basically helping our body be ready to fight in case we get exposed to the infection. That's how mRNA vaccines work. The other vaccines, such as Johnson & Johnson and all the other vaccines we're used to for years, they work differently a little bit, but basically you take a small piece of the killed virus and you put it into the body, and the body makes the antibodies to help fight the infection. Now, the COVID vaccines specifically, the mRNA vaccines are relatively new, but the technology is not new. This has been around for many years, just not used in vaccines. So when people say this is a brand new technology, that's actually not the case. It is a technology that we've had for years, but now it's being used for vaccines. The answer to the question, are they safe, is they are as safe as we can hope to expect, to be honest with you. So there are some side effects which we're going to go over later. But number one, I want to let everyone know that there's no live virus going into your body or into your child's body at all. Okay, it's a little tiny mRNA that goes in there. Number two, it is broken down soon after it's into the body. And these vaccines have no eggs in them. They have no preservatives. They have no latex and no metals. They're actually safer than the great majority of the vaccines we've had out there. So I was excited to get it myself. And when I did the research and I read all the ingredients, I was comfortable giving it to my children and my nephews.
So you would say the vaccines are completely safe to take except for the side effects And except in those very rare circumstances where someone might have, for instance, an allergic reaction?
So absolutely. So what I would say is they're much safer than getting COVID. Okay. Nothing is 100%, right? It's impossible to have anything that without side effects, whether it's a medication or even a food, right? You eat beans, you have stomach pain sometimes. That's a side effect of eating beans. So I wouldn't say that there are no side effects. I would say is my choice to give it to my children had to do with the risk of getting COVID and what could possibly happen to them if they got COVID versus if they got a vaccine.
Very good. What are the side effects and some of the risks involved in taking the vaccine?
Okay, so I just want to make sure everyone understands my point of view is that these vaccines are effective. They were found to be effective in kids 12 and up. We're waiting to read the rest of the studies, and I'm super excited to read the rest of the studies for kids under 12. So they're very effective in preventing hospitalization and severe illness. They were never meant to prevent infection, right? So if you get an infection, but you don't get sick from it, then this vaccine has done its job, in my opinion. So if the vaccine prevents your child from having problems with brain fog or having problems with going to the hospital with respiratory trouble or having heart problems, then this vaccine has done its job. So the possible side effects and the ones I experienced was a sore arm. So your arm or your child's arm will be sore for 3 to 4 days. You will feel somewhat tired for a couple of days, which did happen to me. I did sleep a little bit more than normal. Some people are having fever for a day or two, but not very high fever. I had like 101.9, I think, but nothing like crazy high. And also that there is a very rare side effect of myocarditis or heart inflammation in some people. Now, the chance of heart inflammation is 60 for every million people. So 60 people out of every million can get the heart inflammation from the vaccine. However, the disease itself of COVID is much more likely to give heart inflammation. So COVID, the disease, is much more likely to give myocarditis to the child or to the patient than the vaccine is. So those are the major side effects that we've noted with the mRNA vaccines.
Very good. Now, what does it mean when a virus has a variant? For instance, we hear about the Delta variant. We heard a little bit about Lambda variant. And how do those variants impact children differently than the original?
So Ralph, before I go into that, I just want to let everyone know that 11.7 million children, which are half of all the children over the age of 12, have already gotten at least one COVID-19 vaccine. And 8.8 million children over the age of 12 have also been fully vaccinated against COVID. So a lot of people are giving their children these vaccines. Now, a variant basically is kind of like a cousin of the virus, okay? So all viruses have to replicate. And in order for them to replicate, they make a copy of themselves. And while they're making the copy, they can sometimes have a typo. Imagine yourself copying a book over and over and over again. There's going to be some typos. So a variant is a virus that was trying to copy itself and made a typo and now made a new different kind of cousin virus. And that's what a variant is. Now, the current variant in the United States is the Delta variant, and it affects everyone differently. But the main studies we've seen so far is that the Delta variant is 5 to 9 times more contagious than the original coronavirus. So it's a lot more contagious. Whether it is causing more severe disease in children or not, the studies are being done. Some studies are saying yes, others are saying no. But the truth of the matter is we're not going to know this for a few years once we look deeply at the data. This is not an easy question to answer. The easy question to answer is how contagious is it? And it's much more contagious than the original one.
Have we seen an increase in hospitalizations and or deaths in terms of the Delta variant? And can they determine whether that happens from the Delta variant or from the original?
So yes, when we do send out a COVID PCR test, they can tell which variant it is. Now, they don't tell the doctor or the patient, but that information goes straight to the CDC. So they have that information. So there's a huge increase in the number of patients testing positive, a correspondingly huge increase in the number of hospitalizations. Luckily, the number of deaths in children is still relatively low, but it is rising, unfortunately, because of the Delta variant.
So that brings us to the next question, Dr. Polack. Who should be vaccinated and who should not?
So the questions I've been getting a lot in my practice are, should I give my 12-year-old or 13-year-old a vaccine against COVID? And in my opinion, everyone who does not have an allergic reaction to an injectable medication should get a COVID-19 vaccine. So if you or your child have problems with food allergies or peanut allergies or medication allergies, like penicillin allergy, that does not put you at an increased risk of having an allergic reaction to the COVID vaccine. The only thing that would put you at an increased risk would be if you had an allergic reaction to an injectable medication or an injectable vaccine. In that case, you have to go to your doctor and discuss with them, what are my risks? What are the possible benefits? And that you and the doctor can figure out what is the ingredient in that injectable that you are allergic to. But if your child has heart problems, if your child has any neurological problems or any asthma or any other lung problems, they are at high risk of getting very sick from COVID. They are strongly recommended to get the vaccine. However, even children who have no problems and adults who have no problems have gotten very sick from COVID. So a lot of my patients also say, Ralph, doctor, not so many kids die from COVID. Why do I want to take the chance of giving them the vaccine? And the answer is really simple. Death is not the only possibility here. It's not between death and life. It's between your child possibly having the other after effects of having COVID, which are, again, brain fog, right? Myocarditis or heart inflammation, heart problems and other heart problems and lung problems. In my practice, I have seen kids who have had, chronic fatigue for months and months after having COVID. I've had patients who used to be A+ students, and suddenly they can't remember anything and they're not doing well in school. The brain fog is getting them, the depression is getting them. So to be honest, these are the cases that I'm worried about as well. It's not only the kids that go to the hospital.
Of course, and we also don't know yet really the long-term effects of COVID because it's only been around and not even 2 years yet. So we don't really know what the long-term impact can be on people in terms of life expectancy or future disability or resistance to future illnesses. All of those things are concerns, correct?
They are concerns, and there's a lot of question marks regarding COVID. You're right, we're studying a lot of things.
Okay, thank you. Now, how long does the protection from the vaccine last? We've heard 6 months, then we've been told that we should get a booster after 8 months. What is your thought on that?
We're still learning the answer to that question. We don't have a definitive answer yet. What we do know is that the vaccines, once you're fully vaccinated, they are protective against severe disease and hospitalization for at least 6 months, probably more, but no one is going to be able to give you that answer because we don't have that crystal ball yet.
Okay. Now, in terms of the 3 different vaccines, that are available, the Pfizer, the Moderna, and the Johnson & Johnson, can you give us a little bit of guidance as to what the difference is between them and which ones would be suitable for which people?
So for kids between the ages of 12 and 18, their only choice at this point is the Pfizer vaccine. It's the only one that they're allowed to get. So if your child is under 18, then you really don't have a whole lot of choice. And I think the Pfizer vaccine is very safe and very effective. It's been found to be 90% effective against hospitalizations in some studies, and even up to 96% effective against hospitalization in other studies. Whether it's super effective against infection is still being studied, but that's, again, not the most important thing. If my child has a little infection and they don't have brain fog and they don't go to the hospital or the ICU, I'm still going to consider that a success.
Absolutely.
So in terms of, Pfizer and Moderna are both mRNA vaccines. And then the Johnson & Johnson for people over the age of 18 is a different kind of vaccine that doesn't use RNA at all, but it uses a small piece of the actual virus that has been killed. So there's no live virus in it. it's not possible for you to get COVID from any of these 3 vaccines. And it just primes the body. It's like telling the body, okay, get ready, get all your soldiers or antibodies ready so that if the virus hits, you fight it right away. So this person doesn't get very sick.
Okay. I mean, I have to say, just to personalize it a little bit, I was vaccinated. I was fully vaccinated back in as of February. I was directly exposed last month to someone who had COVID. And I went, as soon as I found out, she didn't know at the time, I found out the next day, I went for a test, I was negative. And I attribute that to the vaccine. I mean, I can't believe that I could have been in contact with someone and been that fortunate not to catch it if I hadn't been vaccinated. So it's a great point, Ralph. Thank you for reminding me, because a lot of patients say, well, how do you know it works? But I'm living proof. You know how my patients have had COVID in my office. And these patients, because they're under the age of 2, are not able to wear a mask. And they see the doctor, and the first thing they do is scream and spread that virus all around. So I have been directly exposed to so many kids who have had COVID, and I'm knocking on wood, I haven't gotten it because I'm fully vaccinated. And I feel like that should speak, volumes, because it's not like I was exposed once, Ralph. I was exposed many times. I'm sure you were. I'm sure doctors and nurses get exposed far more often than anyone else. I think there's also a point I'm going to come back to on that one with doctors and nurses when it comes to mask wearing, which we'll get to in just a second. We also had some questions about, I think you answered about, which vaccines are appropriate for children. Right now, it's only the Pfizer, and that's only for children between the ages of 12 and 17. People 18 and over can receive any of the 3, correct?
Correct.
Okay. And how effective is the vaccine for children age 12 to 17? Is there any data that supports the efficacy of the vaccine at this point yet?
So regarding the Pfizer vaccine, there are 2 studies that have been out, and there's tons more still being done. So the one study out of Israel has shown that the Pfizer vaccine is 90% effective against hospitalization. And the other study that is out of England shows that the vaccine is actually 96% effective against hospitalization. So I think that's an incredible effectiveness rate. In terms of how effective they are against actual, infection, it's still, nobody really knows for sure yet, to be honest. There's so many studies still being done to look at that.
Right, but as you say, if it's effective against hospitalization, serious illness, and certainly I would call it a win if it prevents death.
It's a huge win.
That's the bottom line. Right.
But it prevents death and brain fog and going to the ICU and depression and anxiety and
absolutely
other things.
Absolutely. I have a number of friends who have had COVID, several dozen actually, and a couple who passed away from COVID last year when the pandemic had first happened. But I have friends of various ages, some my age, some younger than me, all adults who still have long-term effects. I have one friend who's in his mid-30s and still has no sense of taste like he used to before he had COVID. And it's been a full 6 months that he's been recovered from it. So I have another who's losing her hair. She's still losing her hair. It's a shame too. She's a gorgeous redhead and she's losing her hair because of the effects of COVID, even though she's recovered from it. So, and one question that I want to ask also, with regard to reinfection, someone who has had COVID, what is the risk of reinfection if someone is unvaccinated? And should someone who has already had COVID be vaccinated? Are there any differences versus someone who has never had it?
So the one study that I read about this, Ralph, showed that people who are unvaccinated are twice as likely to get reinfected than those who are vaccinated. So if you have the disease already and you don't get another vaccine, but you get exposed again, you're twice as likely to get the disease a second time. But if you are vaccinated, you're not as likely to get the disease.
So you would recommend then that even if someone has had COVID, they should go get vaccinated?
Absolutely. Oh my goodness, absolutely. You don't want to get this twice. Trust me. It's not one of those things that gives you lifelong immunity as far as we know right now. And I have seen people get it twice.
Mm-hmm. Yes, I know. I have friends who've had it twice too. What about breakthrough infections for those who have been vaccinated? Have we seen, is there any way to determine who is more likely to have a breakthrough infection?
No, there isn't.
There isn't.
There simply isn't. So if you have been vaccinated, you're unlikely to get very sick from it. But is it possible for you to get infected? It is possible. It's not highly likely, but it's still possible. It depends on, how close you were to the person. Was there any moving air in the room? Many other factors that we could discuss for a long time, but we don't know how to predict at this point. And that's why even if you're vaccinated, you should really wear a mask as well.
Mm-hmm.
I just want to address that issue 1 minute because it's an issue that I deal with in my office every day. I want to think about it as layers of protection. I'm not sending my child out into a snowstorm with one jacket on. My kid is going to wear 2 jackets and a hat and gloves and a scarf. Okay. So this vaccine is the jacket. Absolutely. So important. But you should also wear a mask because you don't want to give one layer of protection to your child. Even if your child has had the vaccine, they need the mask to make sure that they're fully protected as much as we possibly can. And again, I will myself make sure that everyone around them is vaccinated if that's possible, if they're eligible. And I will make sure everyone around them is wearing a mask.
Mm-hmm.
As a parent, it's our job to do multiple layers of protection, not just one. The vaccine is awesome, amazing. Masks are also necessary, and so is hand washing, and so is staying away from sick people.
Mm-hmm. Right? All of those layers, that makes sense. And I think that's one of the biggest concerns for our parents is how to maximize protection for their children, which of course is the school district's primary concern too. Our first and utmost priority is keeping our students safe. So we're implementing a lot of safety measures for that reason. Now, one question, getting onto the mask subject, do fully vaccinated people still need to wear masks? And one of the big questions that we get is it safe to wear a mask all day? The children are in school for 7 hours, with the exception of perhaps a 20-minute period when they would be having lunch, when they would obviously have to remove it to eat. They'll be wearing masks all day because we will not admit anyone to our buildings who is not wearing a mask as per the governor's order. That includes staff and students and visitors. So what are the effects of wearing a mask all day?
So first I want to say, even if you're fully vaccinated and your child's fully vaccinated, if you're indoors with other people that are not in your household, I strongly recommend that you wear a mask because you don't know what everybody around you is doing. And these vaccines, as amazing as they are, nothing is 100%. Please use multiple layers of protection for yourself and your child to stay safe. Now, I want to talk about the masks from a different point of view for a minute. So for many years, we have been using masks in the OR, in the operating room. So surgeons go in, they wear their mask, and they keep it on as long as it takes. 4 hours, 10 hours, 12 hours. This surgeon is not taking off their mask during the operation because they think it's bad for them. They're protecting that patient. And that's been happening for decades, not for days or years or weeks. And these surgeons have not suffered heart problems or lung problems or carbon monoxide or carbon dioxide poisoning from it. So this is a great way to help us all understand that masks, they will protect everyone, both you and the people around you. They do not cause any long-term damage. And yes, kids do wear masks for long periods of time without any major problems. Now, some parents are coming to me and saying, my kid, there's no way they're going to keep the mask on all the time. But let's think about it this way. Your child, when they come home, you ask them to take off their shoes, and they do. But when they go to school, they're not taking off their shoes because that's what's expected of them. Your child will do what's expected of them. If you say to them, you take off your shoes at home, but at school, please don't take off your shoes. That's what they're going to do. You say the same thing about the mask. You say, at home with me, you can take off the mask, but at school, you don't take off the mask. And that's going to help them understand the whole idea of when to wear a mask and when not to wear a mask. And our children are so amazing. They can, number one, mirror our points of view, right? So if I wear my mask, my kids are going to wear their mask as well. And they're going to know that I'm not only doing it for me, I'm doing it for the grandma that's in the supermarket with me, right? I'm doing it for the newborn who has to go into the supermarket with mom because she has no one to leave them with. So you can say to your child, it's your job to protect the little ones and the really old ones by wearing your mask, and they will get it. That's one way of helping our children be part of the community.
I think that's excellent. I think that's really excellent, because that way we're bringing them in and giving them responsibility and teaching them that they're doing this to protect other people. Because that was going to be one of my questions about, there's a bit of confusion also, I think, with people about how masks actually work. My understanding is that we wear masks to protect others. It provides some layer of additional protection to us, but even more so, it provides protection to other people from any possible germs that we might be carrying. I think one of the things I had mentioned to you the first time we spoke was that in Japan, for instance, it's culturally acceptable and practiced, and has been since World War II, to wear masks normally when one goes outside of one's home. That started initially because of the fallout from the nuclear bombs back in 1945, and that was to protect people, but it became a habit that everyone wore. And as a result, my understanding is that they have a lower incidence of colds and flu in Japan than we do in the United States, and that masks are a significant part of the reason why. I always tell people, how many people do you know who caught the flu last winter? I don't know anybody who got the flu.
Patients, Ralph.
Nobody, because we were all wearing masks. Right.
First year in 25 years, I did not see one person with the flu. I was super excited.
Exactly. I thought the same thing. I was like, this is great. I mean, and I'll tell you also, just a side note, it works really well at preventing allergies. I have really bad hay fever, and ragweed gets me at this time of year. If I wear a mask when I go out to walk my dog in the evening around sunset, which is when the pollen count is highest, I also find that I don't have as bad a reaction because it's protecting me.
Exactly.
We have a number of questions that came into the chat. I want to tell you, you got one here who said, Dr. Noha has always been great for UC kids, from one of our participants. So, well, we know you have a great reputation among our community, and the parents really appreciate you. I also want to tell you that another parent said in here, and I'm going to read this. This was very informative, and you cleared up all my doubts regarding the vaccine. Thank you, and I plan on getting vaccinated. So
thank goodness,
yes,
I'm so happy.
That's exactly what we want to see. If one person more vaccinated is one person safer for our community, that really makes us happy, and we hope lots of people feel that way.
Wait, Ralph, can I make one small thing that I wanted to just
absolutely
before we go on? I want to let people know that 96% of all the doctors in the United States got a COVID vaccine.
Wow, 96%.
96%. So the people that you trust with your care and your children's care, 96% of us got our vaccines. Just letting you know.
I think that speaks volumes, and that beats, we're very proud in Union City of the fact that we have a higher than 70% vaccination rate for adults, which is really good. Also, another little statistic I saw just the other day that came out from Trenton, Hudson County actually has the highest vaccination rate for teenagers 12 to 17. We are higher than Bergen County. We beat them by 1%. So we're doing really well in Hudson County with getting the vaccination effort out. But I think the fact that doctors have an even higher vaccination rate really tells us all we need to know as far as vaccinations. So let me read you some of the other questions that we got here. Now, this one is specifically from a parent asking about a child with asthma. How safe is it for children with asthma to wear the mask during an 8-hour school day?
It's actually safer than not wearing the mask, because if you think about it, every patient that I know with asthma, they get triggered by having a common cold. Okay, so all these kids, they get exposed to someone with a cold, and instead of having the regular runny nose, they're wheezing and they need all their inhalers and possibly steroids. If you can keep your child from getting a common cold from someone, you can keep them away from asthma. So the mask does not restrict your breathing. Again, surgeons wear it for hours. If you're trying to tell me that masks restrict breathing, I strongly disagree. We have been wearing it for hours at a time, and some surgeons have asthma. So that's not a problem wearing a mask if you have asthma.
Thank you. I think that's very clear. Do we know when vaccines will become available for younger children under 12? What is the time frame, and do we know which vaccine it might be?
I was just in a meeting last week about that. The answer is they're hoping to submit all of the study results to the FDA by September, and the FDA will look at it, and then they will decide when it is going to be approved for emergency use. I just say that the FDA is being super duper careful with kids under 12. And I super appreciate that. As much as I want kids vaccinated fast, I know for sure that they're taking a look at every possible issue thoroughly before they approve it for emergency use. So hopefully by the winter, but they will not give us an exact answer yet.
Okay. Also, since you mentioned that, I'll throw one out there because I think we want to be clear. What's the difference between the emergency use approval by the FDA and full approval, which Pfizer just obtained last month, and which I believe Moderna should be up for next month because they applied for the approval a month after Pfizer, correct?
Yes. So just to be clear, the Pfizer vaccine was approved for 16 and up. So fully approved for 16 and up, not 12 and up.
So it's still an emergency approval for 12 and up.
For 12 to 16, just to be clear about 16, that.
Okay.
And so the difference is emergency use authorization means that it has been shown to be much more helpful than harmful. Now, once it received the approval, the real approval, that means that they already looked at all the data for a minimum of 6 months on millions of people before they approve it. So this vaccine is very safe.
Very good. And we got a question. If I don't.
Oop, you're muted, Ralph. I can't hear you.
How did I do that? Okay.
Okay.
I said there's a question, if you don't mind answering. Someone asked, which vaccine did you get for yourself? And I'll answer that one too. I got Moderna, as did my entire family.
So when I got the call from the hospital where I work, and they said, we have a vaccine for you, I just said, okay, I'm coming. No idea. When I got there, they say, this is what we got. We got Moderna. You want it? I was like, absolutely. Give me that shot. So I got the Moderna because that's what they offered me. If they had offered me Pfizer or J&J, I would have given them the exact same answer. Give it.
Right. I felt the same way. As long as, I mean, I've gotten every vaccine that was offered because my parents made sure that I went to the doctor and got all my vaccines, and I've never had any of the diseases that they were meant to prevent. So I can only conclude that vaccines work. So,
well, yeah, I mean, vaccines definitely work. Nothing is 100%, but it's a world apart from how people used to live before vaccines. I was watching a TV show about FDR, FDR, Franklin Delano Roosevelt, and
right, who had polio.
And he was quoted multiple times saying if there was anything he would change about his life, it would be having polio. He wanted to walk. How lucky are we don't have that around? So I am absolutely for vaccines.
Absolutely. I mean, I've seen documentaries on the subject myself, and child mortality, the infant mortality rate, and infant meaning children under the age of 3, dropped significantly in the 1950s when the vaccines started becoming more widely available. That's why we've eradicated smallpox. That's why we have largely eradicated polio, because of the vaccines. And they do take time. I mean, it takes a couple of years before that actually gets sufficiently into the population to be able to deny the virus a host. But after enough people have been vaccinated, the disease dies out because it simply doesn't have anywhere else to go, correct?
I sure hope that happens with COVID, because boy, am I tired.
I can imagine that. I can imagine.
The community is tired. The kids are tired.
Yes.
It's been the longest year and a half for sure. And I feel for the teenagers, to be honest, Ralph, more than anyone.
Yeah.
These teens have suffered more than the adults and more than the little ones. because it's the most important time for them to be social.
Mhm.
And they can't survive without socialization, and they've suffered so much. And when I see a patient in deep depression, it affects me terribly. And I say to the parent, if you consider please getting them the vaccine and letting them go with their friends,
Right.
let them be with their friends, and that makes a huge difference.
Absolutely. Absolutely. You know, one of the questions we got last year was, you know, how has this affected the students? And you know, our students last year, the class of 2020 couldn't have a graduation ceremony. They couldn't have a prom. They couldn't have a lot of the life events that all of us took for granted because of the pandemic. At the same time, they had to adapt at a much younger age to the life lesson that you can't control certain things, and you have to learn how to live with the ups and downs that are unexpected, which hopefully will help them in future years. Because they will have learned that lesson at the age of 16 or 17, rather than having to do it when they went out in the world on their own. To go to the next one, would you recommend waiting for the Moderna vaccine to be available for kids?
No. No. So my point of view is the longer you wait, the more chances you'll have of your child getting COVID and having those side effects.
Mhm.
If my children were not yet vaccinated, I'd go today and get them vaccinated, to be honest.
Very good. Since the vaccine is not approved for children under 12, does that mean that there is something dangerous about it? Why would it not be approved for younger children?
The original studies were done on people over 18, and then the studies were brought down in age over and over again. So because the studies are being done on different ages at different times, that's why the vaccine has not been yet approved for that age group. It simply has to do with, we started with adults, then we went to adolescents, and now they're doing the studies on the children and evaluating them. It has nothing to do with it being dangerous for children.
Okay. Are there additional risks for children under 12 who have other conditions such as allergies and asthma to go to school?
So again, we want to layer protection for our kids, right? So if kids have allergies and asthma and they go to school with their mask on, they're still going to be better off than staying home and being sad, depressed on not learning anything.
Right.
So your job as a parent and my job as a parent and physician is to maximize their well-being. And that includes being with people their age who are masked and as much as possible vaccinated. Kids don't learn well at home. The great majority of the parents in my practice are just so sad about the lost time that happened. So I would say that it does not put them at an increased risk enough to keep them home and isolate them. Isolation is deadly as well.
I agree with you. I had a friend who's an educator had suggested, you know, that perhaps we should have a virtual option nationwide for all children, you know, from the beginning to graduation. And I said, what about the social emotional component? You know, students are missing out on that when they're at home, and only under the most dire of circumstances would we deny them that type of social interaction, as we had to last year, because it was a matter of life and death, literally, and we didn't know anything about it. I think one of the things that's also important to point out, perhaps, is how much more we know now about the virus and how it's spread than we did when the pandemic first happened. Because one of the comments we'll get from people also is, well, why are we being told different things at different times? They told us one thing last year, they're telling us something different now. And it's because we've learned so much more about it. Yes?
Absolutely. So as a doctor, I'm used to being able to look up something, whether it's in a book or online, in a medical journal, and know the answer right away. COVID threw me a curveball and the rest of the medical world a curveball. There was nowhere we can look things up. So we had to make the best decisions possible for ourselves and our patients. What we know now is so much more. So if your child were to get admitted to the hospital in April of 2020, we did not know as much as we do now about how to treat them with COVID. Now we have medications, we have antibodies, monoclonal antibodies, we know who to give steroids to and who not to give steroids to. So the knowledge base is much more, not only about transmission, but about treatment and about prevention.
Okay. There's a question about the COVID antibody detection test. Does that offer any benefit?
You mean the rapid ones?
It says the antibody detection test, so I would presume that that's
Yes.
somebody who's asking about, because that's the
Yes.
test that would determine if you've already had COVID, yes?
Oh, the blood test, I agree. So the antibody test is a blood test. And so the reason we're not doing it routinely on all our patients is because even if you don't have antibodies, it's possible that you have some other type of immunity called humoral immunity. And some people who have antibodies still get infected with COVID. So it is not a definitive way to tell if you're either safe or at risk of getting the disease.
Okay, thank you. Here's a different type of question. What to make of a positive test result in a vaccinated person who subsequently has a negative test result a few days later, but has no symptoms?
So if the test is a PCR test, not a rapid.
And by PCR, I'm sorry, could you explain the difference, Dr.
Yes.
Polack?
Yes. So if you go to your doctor and you get a test in your nose, they can do a rapid test, which is called the rapid antigen test. And that one is not, the rapid antigen tests for the most part are not as accurate as the PCR test. The PCR tests, they test in a different way for the actual virus in the nasal swab. So the PCR tests are much more accurate. So if that person was initially positive with a PCR test and then negative, it means that they had the virus and their body cleared it real fast because they were vaccinated. If it was an original antigen test, so a rapid antigen test, then we don't know whether that was a false positive or not.
Okay, thank you. Someone's asking which mask is safer? Is there, I think we all know the N95, so maybe you could give people a little bit of an explanation about how the masks function in that respect.
The mask that works best is the one that fits best. So if the N95 is too big for your face or your child's face, it's not a good mask for you, okay? So you want to make sure that your child has a mask that fits not only on their nose, but here, especially this spot here on their face. So I would love it if every parent bought a couple of masks and tried them on and see which one fits the best and is the most comfortable for the child to wear. And that's the mask you should have. An N95 that's adult size on a child's face is not going to do the trick.
Thank you. Now, there's a question here I'm going to modify a little bit. It's someone who's asking about special needs students and saying they can't be vaccinated. Now, my understanding is that neurological conditions are not prohibitive of getting a vaccination. Is that correct?
So I cannot speak to all conditions, okay, but I can tell you the great majority of people who have disabilities are able to get vaccinated safely. I cannot speak to every patient, and that has to be discussed with that patient's physician. But patients in my practice who have problems such as convulsions, seizures, some developmental delays have been safely vaccinated.
Okay. And again, we're getting a question about someone saying asthma and cannot be vaccinated.
Asthma in a child who's over the age of 12 is not a good reason not to vaccinate your child. As a matter of fact, it's a best reason.
Better reason to vaccinate your child, right? Your
child. Asthma does not put you at an increased risk of having an allergic reaction to the vaccine. That is not the case.
Very good. I'm also just going to say, I know we have a number of questions that are coming in to the chat, which are related to the district and how we're going to handle things like social distancing in the schools. I'm not going to bring those up at the moment because Dr. Polack is here to answer medical questions. She can't speak to district policy questions, but those district policy questions, you are welcome to send to us. If you'd like to email them, you can send them to social media at ucboe.us. or you can go back onto our Facebook page where I posted the original notice about today's session, and you can post them there and we will address those questions. Most of them already have been addressed in the letter that we sent out to parents last week and that we posted on our website and on our social media pages 2 weeks ago. You can go and see them there. And all parents in the district should have received that letter. Okay. Let me just see, we have addressed some of the side effects. And okay, one of the other questions again, if a teen has a disability, should they get the vaccination? Absolutely, that was.
I want to make sure people understand that the best source of information for a child or a patient with a disability is their own physician.
Their own doctor, yes.
All of your doctors are there to answer your questions. You know the specifics of your child, especially your specialists. Please ask them. In my practice, when people ask me, I look at their situation and then answer them. And I would say 99%, I say, please get that vaccine. But I cannot speak to children with disabilities that I don't know about.
That's a very fair answer. That's a very fair answer. We have a question saying, what are excusable reasons not to vaccinate? What reasons would there be for someone not to get vaccinated? Earlier, you mentioned someone who has a reaction to injectable medications. And just so that I understand that, because I think other people would probably have the same question, by a reaction to an injectable medication, you're talking about if somebody gets a shot and they have a really severe reaction that involves, for instance, anaphylaxis or something like that. Yes.
So if you or your child had an injectable medication, either IV or as a shot in your muscle, and then you could not breathe and you had a rash all over your body and you needed to get an EpiPen to save your life, that's a reason not to get the vaccine until you go and see your doctor about what exactly is the ingredient that caused that reaction. As far as I know, there are no other great reasons for children not to get the vaccine. Now, I am not a specialist, so I cannot speak to about people who have severe diseases such as severe lupus or some other immunocompromised individuals. That has to be spoken about individually, not as a population type of question.
Right. Yeah. My understanding was that certain immunocompromised people, for instance, sometimes with HIV, especially if it's long-term, that the vaccine may not be effective. And those are also people. Those are also people for whom we are getting the vaccination, because we're protecting the people in our community who are not able to get it, those few people who are not able to get it, and are counting on the rest of us to build up the herd immunity so that those people have a chance of coming out of the pandemic lockdown and actually resuming normal life. Yes?
Exactly.
Okay. I think that is all of the questions we have in the chat. If anybody else has any others. Okay, getting a question on graphene oxide in the Pfizer.
I cannot answer that question. I read the ingredients and I did not see graphene oxide.
Okay. Any other questions coming through? I think that's it. I think we've got it. Yes, there's a question about, since we both got the Moderna, if anyone has gotten the Pfizer and how it's different. I can tell you that when the district had our vaccination initiative back in the spring, which was extremely successful for the staff, for members of the community, and for our students who were eligible, that we were offering alternately the Moderna and the Pfizer, depending on what vaccines we received. We didn't have a choice which ones we received. The County Board of Health sent us what we had, or what they had rather, and that was the one that was offered. We had a limited number of J&J vaccines at one point. So we have members of the community who have received all three types of vaccines, and we've had no reports, certainly to the district, that I can tell you, of severe adverse reactions. I know whether or not that would necessarily come to us medically, it wouldn't, but we haven't had anybody who's reported back to us that that they had a severe reaction.
So I wanted to answer that question as well, Ralph. Both of my
Thank you.
children got the Pfizer.
Mhm.
My mother, who's in her late 70s, got the Pfizer. And so did my two nephews, because that's all they had available for them age-wise. And so I wanted to say that all of these people, including my own children, with the Pfizer vaccine, they had the similar reaction as the Moderna, which was sore arm and tired for a day or two.
And that's pretty much what I had too. You know, and when I got my second shot, I was a little more sore in the arm for a day or two, but I had absolutely no lethargy, nothing like that afterwards. I was perfectly fine to be at work the next day. And to be quite honest, I have to tell you, I think the biggest thing for me was the emotional sense of relief after I got that first shot. And my mom's going to be 80 years old also, and I was there with her at the same time, and to know that my mother was safe and that we could rest assured that, you know, we have some protection. That was probably the biggest sense of relief I felt in the past 2 years. You know, the idea that we could start resuming some semblance of normal life, knowing that we were doing our part to protect ourselves and other people.
Exactly. So Ralph, I just want to end it because I do have a patient to go see.
I know you do.
I want to end by saying that there are vaccines available at most of the drugstores in our area, and that there is a number you can text your zip code to, and they will tell you where you can go for your vaccine. Do you know that number, Ralph, or should I?
I do not know that number, but I would
it's so
love
exciting.
to have
I know one thing. Okay,
it.
here's what I know. If you text your zip code to 438-829, I'm going to repeat it. Text your zip code to 438-829. They will tell you the places around your zip code where you can get vaccinated against COVID.
Great. That is wonderful to know. And I will also tell everyone who's here in Union City that we have a testing site on 36th Street between Bergen Line and Kennedy Boulevard that the city maintains, where you can go and get tested. And there are vaccination clinics that are available. We are going to be announcing more of those ourselves. As a matter of fact, there's one going on this very afternoon for students. And as a matter of fact, they were even giving them $15 Target gift cards. So the lucky people who went there got a little gift as well, in addition to a life-saving gift. So Dr. Polack, I want to thank you so much. I don't want to impose on your time. I know you have a lot of patients, so we really appreciate you taking this time from your busy schedule. Your expertise is overwhelming. I really appreciate, because I learned some things here too. And I think many of our parents, I don't know if you can see the chat, but they are thanking you and thanking you and thanking you and thanking you repeatedly. I think you have done a lot to alleviate the concerns in our community. And I hope that that will lead to an increase in vaccinations, and to everyone's feeling comfortable wearing masks when they're out in public. And just a reminder to everyone that those are required in our school buildings. And we encourage everyone to get vaccinated who is medically able to do so, because those are our two best tools against this virus.
And wash your hands.
And wash your hands, absolutely. And that one we have to be teaching them from way down, right? So,
exactly.
Dr. Polack, thank you so very much. We really appreciate you.
It was my pleasure. Thank you for the opportunity. Have a great day, everyone.
Thank you, you as well.
Bye-bye.
Bye-bye. I will just say to everyone, thank you very much for participating. We appreciate all the great questions. I will say again, if anyone has questions for the district, you are welcome to send them to social media at UCBOE, Union City Board of Education, .us. That email comes to me. I will answer those questions for you. You're also welcome to post them on our Facebook page, on the in the same place where I posted the flyer for today's event, and we will get back to you on them. The one question I know that came up, and Mrs. Abato did respond to it in the chat, is regarding virtual. Just so that everyone understands, Governor Murphy's executive order required all schools, or requires, I should say, all schools in New Jersey to be open in person, and prohibits a virtual option except in cases of quarantine class, and then only for the duration of the quarantine. Meaning that if there's an infection in a class and the class has to be quarantined, they go virtual for the 2 weeks that they're on quarantine. That's it. Otherwise, we can't offer a virtual option. So while we appreciate your concerns, that's simply not something that we have any control over. And again, masks are mandatory also according to the governor's executive order. So they are required at all times when anyone is in one of our school buildings, except when they're alone, as I am at the moment, in their own office or classroom. Thank you again for participating, and we look forward to seeing you next week and to having a fantastic 2021-22 school year. Have a good afternoon, everyone. Bye-bye.